Hi Emily, welcome back. It's great to see you again. First of all, I have some good news for you. You've done the right thing by coming in to see us. After examining your x-rays and the results of our series of tests, I feel really confident that what you have is treatable with chiropractic care. So the good news is, you're in the right place at the right time. Now, because what you have is a chiropractic problem, I want you to know some important facts about chiropractic. So, as you may remember from the video we had you watch yesterday, chiropractic is not new, it's not experimental, it's been the successful choice of treatment for cases just like yours for over 100 years now. And what I think might be more important for you to know, with a study that was done with WebMD, they took 2 million patients over 4 years and found that chiropractic care has a 95% satisfaction rate. 95%. You know, if we're taking a look in the medical world, it's impossible to find a better record of success than that. So you can feel really confident that what you have, you've come to the right place for the solution to the health problem you have. Now, another important thing I wanted to point out about chiropractic care is it's natural. And it's important in our world today. You know, we're in a very drug-dependent world. And taking a look, our bodies have an amazing capacity to heal itself that can be superior to anything that man can make. For example, like a drug. And the body is better than drugs, and we have to rely on it first. Have you ever thought about how the body knows just to heal itself from something even as simple like a cut on our finger? It will stop bleeding and put itself back together, and in that short time, you're unable to even see where that cut was. And the body naturally heals itself from a system called our central nervous system. It knows better than what we do to be healthy. So when there's no nerve interference, our body can better be able to diagnose itself and heal itself. So the first choice of healing should be natural before resorting to drugs and their harmful side effects. Drugs and surgery have their place, but it should be our last resort, not necessarily our first. Alright, so let's talk about why you're having this pain. Why do we feel the way that we do? So first of all, your pain didn't start yesterday. It didn't start the day your pain started either. Pain is normally one of the last things to show up in these situations. And your body's been building this over a lot of time. And it's been caused by accumulation of events over our whole lifetime. So in fact, it can even start as we're little babies. Have you seen a baby be born? There's definitely a lot of stress that happens to the head, neck, rest of the spine. It doesn't stop there. Let's think about all those spills and accidents that we had as children, even as teenagers, and we needed that care the whole time we were growing up. Think about it. Think about those injuries we've had, and it's amazing how any of us live past 5 years old with all those hits we took. And yet, oftentimes, those physical traumas are left untreated. The point that I'm trying to make is that we've needed chiropractic care since birth, and it could have saved us from a lot of the problems and the wear and tear that we have now. And certainly if we think about it, if we do have any kids, or maybe we're thinking about kids, we want to keep it in mind because they're probably going to live to be 100 years old. And we want them to have that good mobility that whole time they're alive. Now, let's talk about more of that lifestyle that we have. So, for example, I don't know about you, I don't lift correctly 100% of the time, and it's impossible for us to know the amount of times that we improperly lift, even with those physical events that have happened the whole time we've been alive. And that's why, as I mentioned in the beginning, it's not just one event. We have years of wear and tear already, and that's with absolutely no treatment, no prevention, no care, and no effects or efforts to offset that wear and tear at all. So I'm going to give you an example like the dentist. So what if I told you, you've never been to the dentist from the time you've been born, or even brushed your teeth? Nothing. So what condition do you think your teeth would be in at this point? Now, if we had any teeth left, they probably wouldn't be in the best condition. They probably would have fallen out by now. So through the years, if we think about it the same way, we've had a lot of damage to our nerves, to our tissues, and that's virtually been left untreated. So it's really fortunate you're not in more pain than you are right now. Now, you need to keep in mind, since it's taken years to create this physical condition, it's not going to be corrected in a day. It takes time. So, for example, we might gain weight over a 10-year period, but then we want to lose it in 10 days. But that's not going to happen. It takes that time. But we'll talk more about that time part a little bit later. But first, let me talk to you about the findings of our exam, where we are right now. So what's that result of that untreated activity? So our spine here has been pushed and pulled out of alignment. That causes less flexibility, causes irritation, creates swelling, even pinching of the nerves as they flow out between the vertebra. That is, the medical term for that is a subluxation. So if you take a look at my chart over here, you'll see some of the problems that can occur with subluxations in those regions of the spine. I think you found that fascinating. I know I do. So the reason that much of our health is impacted by this is because our nerves run from our brain. They communicate commands to the rest of our body and to our other organs. That's how our body knows how to function and heal itself. So I know you came in here today, you're having low back pain, but I want you to take a look at the chart and see the other things that are associated with that area of the spine. So it can be pain in the groin, pain down the leg, even cause GI issues. And I know we talked about that the other day. That sounds like a lot of your issues, doesn't it? And the reason for this is that pinched nerves have that same effect that we experience today with our cell phone. So if there is any interference with the call, say we lose it, it starts breaking up, I don't know about you, but around here, I try to get somewhere immediately so I can get that whole message. And that's what's happening with our central nervous system. With that nerve interference, our body's ability to communicate is cut off. And the result that happens is that we get that pain or even disease. So, subluxations can cause more than neck or back pain. It can cause many other types of disease as well. So it's more than just having pain in your back. It's how it's affecting other areas as well and how our body heals itself as a whole. Does that make sense? Now, before I take you back, I just wanted to quick go over this. It's our little chart of spinal degeneration and with their 4 stages. So just as we would think of any other health conditions, for example, use cancer. The longer we let this go, the more severe the stage and the more severe our health problems become. So it's important to start treating and preventing further stages. So right now, I would place you at a mild in your low back with spinal degeneration. But let me take you back and we'll take a look at those x-rays so you can see exactly what I'm talking about. Let me have you come on, head back with me.